We've been talking about the opioid epidemic and how serious it is, and now the Houston Health Department is working to address the crisis with millions of dollars in grants to reduce overdose deaths, to get people into treatment and provide education. Here to talk about those efforts this morning, we have Local Health Authority and EMS Director Dr. David Purse. Good morning to you, along with the Executive Director of the Houston Recovery Center, Leonard Kincaid. Glad you're here. Also, Peer Recovery Support Specialist Jessica Yeager. What a team. And we see how serious this problem is, and we need it. We've got a big problem here in Harris County. Right. So you guys are doing what you can to combat it?
We are. Actually, it's a collaborative effort with a number of different agencies that we brought together. And so the Frontlines grant is the Baylor College of Medicine, the University of Texas San Antonio, the Houston Health Department, and the Houston Fire Department all coming together under this grant, and the Houston Health Department to try and manage to make a dent in the problem.
So how will you do that? Where do you start?
So this grant is one of several grants, but what we're doing with this grant is when the firefighters pick up a patient and they actually treat them for the overdose and are transported to the hospital, simultaneously the Houston Recovery Center with peer specialists are going to be notified, and we're working with the hospital so that they can then go to the hospital after the patient is stabilized and then interact with that patient to see what services we can offer, because there are services available in the community, but it's that linkage that has been a big problem, and try to get those folks into therapy. And then working with other partners, you're going to be following up with them over the next couple of days.
Being at the Recovery Center, you're on the front line, and you see how serious this problem is. How much does it mean to you to be a part of this, and how serious do you feel like we're suffering here in the Houston area from this problem?
We are an ideal partner for this. We were created as a diversion site for individuals arrested for public intoxication. And the biggest drug that we see coming to our center, of course, is alcohol. But we've been surprised at the number of individuals coming through the center now that's reporting opioid use. And so to have a program that's as early in the intervention stages we are in terms of addressing this, we're putting a system together. The system is comprehensive. We've got our partners that reach all the way across the entire Harris County area, and all of supporting having EMS as a partner, because they are really frontline. They often catch these people while they're in a crisis, and when they get them in a crisis, taking advantage of them identifying these individuals and allowing us to intervene is, I think, huge in terms of the model that we're implementing here.
And let's talk about peer recovery support and what that means and how you're involved with this project.
So I'm also a person in recovery with lived experience. So with my lived experience, I can relate to the individuals and pull them into treatment right away. So what that looks like is someone that's suffering, that's seeking services, we can plug them in the same day, help them with Medicaid-assisted treatment, and get them plugged into ongoing services, so they no longer have to be suffering from an opioid addiction.
That's huge, right? So they feel comfortable talking to you about these things because you already know what that feels like.
Correct.
Let's talk about what you're trying to do now. So you're still trying to gather data. You're still trying to get our community involved. How do we all play a role in this?
Well, one thing is that, unfortunately, there's a stigma that's associated with opiate addiction, which really does not belong there. Anybody can become addicted to opiates, and we've seen, it's been in the news, but I don't know that the general public has really latched on to the fact that many of the folks who are addicted to opiates today got addicted after some type of a surgery or an injury. So we have people with very productive lives. They're not the stereotypical person under a bridge. They're people who've got families and careers who become addicted and struggle quietly until the wheels really start falling off, their lives start to deteriorate, and then we find them in places where the ambulance gets called, and we can prevent all of that if we all work together. And the big thing is what can we do? We could stop stigmatizing people who are suffering from a real illness.
And if we see that they're suffering, try to help them. Get to a recovery center and find help. Thanks for what you're doing right here in our community, and it sounds like it's great. I hope you'll let us follow up and see how things are going with your progression.